Right now, we're going to bring in that oncologist I'm telling you about at Levine Cancer Institute in my hometown of Charlotte, North Carolina, Dr. Arielle Heeke. Great to see you, Dr. Heeke.
Hey, good morning. Nice to see you, Anna.
So I just mentioned this new study from the American Cancer Society released this week, finding that breast cancer in women under 50 has increased 1.4% annually from 2012 to 2021. What do you think's behind this, and how concerning is it?
Yeah, no, we're definitely seeing this in clinic more and more. You know, it used to be a rare instance to see a woman in her 30s, but now it's more common. We're even seeing young women in their 20s. It's hard to say why this is happening. I think some of it is certainly awareness. Word is getting out there that women need to be more self-aware on their exams, to bring it to the attention of their providers to seek a mammogram because, of course, they're not in the age group that's getting a regular screening mammogram. So
Yeah.
possibly some of it is just from awareness with programming like this.
Right. I mean, I think about even when we were young and the breast cancer awareness walks that were just beginning and all of that. And now, we all talk about it with our friends. You got to get your mammogram if you're over 40. I just turned 40 and I haven't gotten mine. So this interview is going to make me do it. So thank you for that.
You got to do it.
Yeah.
Absolutely.
The same study found that instances among Asian American and Pacific Islander women at all ages, every single age, their rates were increasing. Why is it higher in this demographic among women? Do you know?
Yeah, the study did a really nice job trying to answer that question. They, speculated that there's actually increased immigration of this kind of patient population. I think some of it also stems from possible lifestyle differences, from maybe how you could be eating food in kind of an Asian country versus coming to America and suddenly your diet is changing drastically. But there's still a lot to be learned from this group of patients for sure.
Interesting. Some of the signs and symptoms, can we pop that back up? That was really interesting. Can you go over some of those as well, Dr. Heeke? So we have a new lump or
Sure.
mass. Of course,
Yes,
that's
yes.
something that you might even notice in a self-exam, but what are some of the other signs and symptoms?
Definitely. So certainly in the younger patient population, it's that self-exam, finding a new lump or mass that's going to lead to additional imaging. There can be pain, there can be new nipple retraction. Some women have nipple retraction just naturally from breastfeeding, but if it's something that's changed to new, maybe worth evaluation. Swelling of the breast, skin changes of the breast, certainly discharge can be a sign that there's something going on internally that warrants evaluation.
Interesting. Well, breast cancer remains the second leading cause of death of cancer for women overall. So when should women start getting screened? Did it used to be 45 and now it's getting younger? It seems like there's lots of numbers
Yeah.
I'm finding out there.
Yes, there are lots of numbers. It actually used to be 50, but the guidelines are kind of moving towards earlier age, which I think fits with this data that we're discussing. I mean, generally speaking, we recommend for women to start annual mammograms at age 40. We've seen this trend in other cancer types as well. Colon cancer screening has been moved up. And really, the reason for this is mammogram is what saves lives. If you can diagnose breast cancer at an earlier stage, we're looking for, precancerous changes or stage 0, which is DCIS. If you can catch it early, you can actually, cure the disease much more likely. So we want it early and we want it often.
I'm seeing a lot on social media, probably because of my age, about this and about if you have dense breast tissue, then you need to take things a step further. What's that all about?
Yes, so our radiologists are doing a great job now trying to identify patients from the beginning that maybe have a family history of breast cancer or have this dense breast tissue to kind of identify them as high risk, which does allow for heightened surveillance of their breast tissue. So what that looks like is essentially an annual mammogram and potentially an annual breast MRI as well. Throughout the country, there are high-risk clinics. So this is something to certainly talk to your provider about if you have a family history of breast cancer, if you might benefit from this additional surveillance, but also if you're 40 and you're getting your mammogram, to certainly ask the radiology team there if this is something that you could potentially pursue.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.